Okay, hello everyone. My name's Abby. I'm a nurse on 6 West, and I'm here with my fellow coworkers.
Hi, I'm Madeline.
I'm Robin.
And we implemented a handoff fall prevention checklist for our new grad project. So just a bit of background here, we on 6 West in 2021 had 18 falls.
So our Pico question that we developed was, in acute care patients, how does implementation of a fall prevention checklist during shift change compared to current practice impact falls?
To collect our data, we used CINAHL and EBSCO. The key words we used were fall prevention and acute care.
So for our first literature review that we looked at, we saw on an oncology unit, they saw that with their patients, falls incidents they had, that 65% of those were associated with toileting. So what they did, they implemented a toileting schedule, and this actually decreased the rate of falls on their unit over the 4-month period that they implemented their project.
In our second literature review by Fowler and Rising, they decided to look at visual aids that were addressed once in a 12-hour shift, so that being a call light, yellow wristbands for fall risk patients, yellow socks for fall risk patients as well, and as just addressing those at least once in a 12-hour shift with the patient helped to decrease their fall rates from 3.3% to 1.9%.
So for our third literature review, we based our project off of this. They used a fall prevention initiative that included a 14-item checklist, and this checklist was to be discussed at shift change at the bedside, so you can visually see the bed alarm, the fall mat, the wristbands, and all the fall prevention tools that we had for part of the protocol. So in this study, they had seen that the biggest problem, or the most frequently missed intervention, was setting the bed alarm. It was set incorrectly 19% of the time.
So our setting and sample. So we are a 36-bed acute care unit, also a rotating COVID unit, and we have patients 18 and older. We have 21 day shift nurses and 16 night shift nurses. We have 8 day shift PCAs and 8 night shift PCAs.
So for the timeline of our project, on December 14th, we finalized our Pico question and our literature review in class. And then from January 2nd to January 10th, we educated our staff and our coworkers during huddle about the project. We decided to start our project on January 11th, and that went through January 29th. And then on January 30th, we collected all of our post data, being all the checklists that were placed in the charge nurse office.
For the 2021 fiscal year, there were 18 falls on our unit on 6 West.
So here's a nice little graph of our 2021 falls. It shows the months of 2021 and how many falls we had each month. So it looks like in January and June we had 3 falls, and then in February we had no falls.
So for our intervention, what we based our project around was a fall prevention checklist. This checklist was to be done at shift change, so day shift nurse and night shift nurse were to check each other and make sure that all the fall prevention protocol that's already been set in place by the hospital was adhered to. So this checklist was printed out by the secretaries and stapled to our handout, our assignment sheet in the morning, so you would grab it when you grabbed your assignment sheet and you would do it during shift change.
So this is an example of our RN checklist. There's a area for each room. We can have up to 5 patients. And then on our checklist, we included the stop signs, the call light within reach. It's a combination of a visual aid and the checklist.
And here's exactly what they receive. So we make sure our patient is educated. We make sure the bed is in lowest position. We make sure our fall mat's on, the yellow socks are there. We ask the patient, hey, have you been to the bathroom in the last 2 hours? So we're addressing their toileting scheduling needs, and we also make sure their personal items are within their reach.
So this is the same checklist just for a PCA. They have more spots for rooms at the tops because they are assigned more patients in there to fill out this sheet during shift change, just as the RNs do.
Here is a graph of our post data, and on average, you can see here about one staff member was submitting the checklist due to multiple barriers that we'll discuss further.
So our outcome. So we saw during the length of our project, we did have 2 falls, and those 2 falls actually, they did not use our checklist. And so in February, whenever we were done with our project and it wasn't really being talked about as much, not a lot of compliance there, we actually had 4 falls.
So some barriers to our project, the biggest one being COVID. Obviously we weren't planning for this whenever we started our project. Our unit does not have any windows on the patient doors, so we had shift change report outside of the patient's rooms. So there was a lack of patient visibility there. We weren't able to see if all the fall prevention protocol was adhered to during shift change. So you had to see it when you went into the room to do your assessment in the morning. Obviously there wasn't as much staff compliance as we had hoped during this time. Because of COVID, we had a lot of floaters and a lot of travel nurses, so they weren't educated as much as our normal staff members were on the project, which could have led to decreased amount of survey or checklists. We did find that a big problem was that the pigtails were not always plugged into the bed. This was not something that we had put on our checklist to look for during shift change, so we recommend that in the future. And then there's some breakdown in communication with the secretaries not always printing the checklist for the handoff report.
So we recommend a just culture. It's not ever appropriate to blame a staff member or a patient for falling. So we also want to follow up with the second victim. When someone falls, it's really stressful and scary for the nurse. We don't want our patients to get hurt. We want to praise up and peer support. Teamwork is very important on our unit. We really value team nursing, effective communication, and ensuring utilization of every patient encounter.
So sustainability. So how are we going to keep this project going? Our manager, Monica, has done an amazing job in really managing up this project. She really wants us to do this. We actually do this with report. She would like PCAs to do this halfway through the shift, and then so it's done in the beginning of our shift, and then again at the end when we give off report. So we also are going to add pigtail to our checklist to ensure we are checking that off as we do our report. We also have been discussing it in huddle, making sure we turn it in during our shift, putting our patient labels on it so the manager is able to audit if needed, and also making sure we have copies by the charge nurse office, and we have been doing that so far, so things have been good.
So here are references that we used, and so far our project was a success, and we thank y'all for taking the time to listen to us today.
Thank you.